If sleep does not perform an absolutely vital function, then perhaps this is the biggest mistake the evolutionary process has ever made. If a person is stressed, it can lead to a sleep disorder. And if a person is having a sleep disorder, he can go into stress.
Do you think sleep quality impacts our work productivity, our ability to perform at work?
Around 35% of the total, accidents, industrial, roadside, aviation, they happen because of sleep deprivation. India is a world capital of call centers. We are fighting against time, and sooner or later it starts showing its effect. This is something which is leading to hypertension, which is leading to diabetes, poor control. It is leading to cardiac failure.
What are some of the warning signs that people should look out for to know that this may be leading to a sleep disorder and I should see a doctor?
Patients are the best judges. If you are feeling that, okay, I'm not able to sleep as swiftly, started having snoring, I get up in the morning non-refreshed. The problem, if it is exaggerated, you must get yourself analyzed.
On the occasion of World Mental Health Day, it's my pleasure to welcome you all to this very important podcast today. I have with me today Dr. Sanjay Manchanda, one of Asia's leading somnologists and a pioneering figure in the field of sleep medicine. As a chairman and senior consultant at Sir Ganga Ram Hospital in New Delhi, Dr. Manchanda has led groundbreaking initiatives since 1996, including the establishment of the first independent sleep medicine department in India. He comes with over 30 years of experience and has done over 27,000 sleep studies, helping thousands of patients revive their sleep and health. Very proud to have you today with us, Dr. Manchanda. Thank you so much for joining us.
Thanks.
Great. So the topic at hand today is a very important one. It is around stress and sleep. How do they go in tandem, and how our work stress impacts sleep and how sleep impacts eventually our life? So Dr. Manchanda, we would love to start with this important topic of work stress, right? If you can help us understand how work stress eventually eventually impacts our sleep on a daily basis, and how, sleep impacts our work. That important, tandem, if you can explain to our audience, that will be great.
Well, the thing is that, let me start with a very beautiful quote. That is, if sleep does not perform an absolutely vital function, then perhaps this is the biggest mistake the evolutionary process has ever made. Because 1/3 of our lives we spend in this period, and I don't believe that it is for nothing. There has to be a reason. Now, the thing is that the importance of sleep cannot be undermined, but unfortunately it is being undermined. So, as far as the stress is concerned, or stress-related diseases are concerned, and sleep-causing stress is concerned, this is a two-way kind of a traffic. That is, if a person is stressed, it can lead to a sleep disorder. And if a person is having a sleep disorder, he can go into stress. So it is something that we cannot single out unless and until we have investigated that what the person is like. It is like a chicken, a hen kind, an egg and a chicken and hen kind of a situation, that who came first. So first we have to ask, there are people who have tendency to have mental, imbalances, who are more prone to it. And if that is the thing which started coming early, then it is impacting the sleep. Whereas if a person is having a known sleep disorder, as a reactive depression, it will cause the things the other way around. So it's important that first to identify which is the primary cause. Is it the disease from the mental disorders, or is it the disease from the sleep disorders? Because then only we will be able to do full justice to whatever we are looking into. In the one part, we will have to take the help. If it is a endogenous depression or a familial depression, a person is there who cannot take stress, then that kind of a person, we need to work in tandem with the psychiatrists as well occasionally. But sometimes it is a kind of a thing which is their perception. So we need to break that perception as well at times. And similarly, if we are having a known sleep disorder, you will be interested to know that there are more than 80 sleep disorders.
Wow.
So the thing is, we are talking of one thing, two thing, and insomnia is, to me, is basically a very, very, say, flimsily used word. Because insomnia is total lack of sleep. But when we talk of this subject, we should talk it as dysomnia, that is poor quality of sleep.
Got it.
A person who cannot sleep for 9 days, 10 days is incompatible with life. So somebody comes to us that, sir, that I haven't been able to sleep for nearly a month, which is something that is his perception. If you ask the family members, no, we think he was sleeping, but when he gets up, he says, no, I was just closing my eyes. So we have to understand where the thing is falling, and then we go and explore the things in the correct manner.
Got it. And sir, you mentioned there are more than 80 sleep disorders, right? Would love to understand when people come to you. I know you're working more on the Delhi audience, and maybe people travel as well. What are one or two most common issues of sleep that you come across?
Look, let us put it that way, that we have at least 6 disorders which are rather common. Some are poorly understood, and some are overused, and some are there. The first will be snoring and sleep apnea. So snoring is a sound which is generated by the vibration of the soft parts of the tongue and the base of the tongue and the surrounding structure because of narrowing of the airways. Like if the air flows through a narrowed opening, it will cause vibration. This vibratory sound is snoring. But it is a cardinal symptom of a condition which is called as sleep apnea. That is, sleep apnea as a word, it means sleep, we all understand, and apnea is stoppage of breath. So stoppages of breath during sleep, and if they are more than, say, 5 seconds, 10 seconds in a duration, and if it is with more than 5 events per hour, it becomes clinically significant.
Okay.
So one portion is this, but today this is something which is leading to hypertension, which is leading to diabetes, poor control. It is leading to cardiac failure. It is leading to cardiac rhythm disorders. It is leading to strokes. It is leading to kidney failures, or it is helping or basically exaggerating the phenomena of many of the things, and essentially sleep deprivation to the same patient. Then another condition is various kinds of insomnias. Insomnia is not a single situation. Insomnia is actually a symptom. It is not a disease by itself. So insomnia, we have to see what is lying underneath it. What is the thing which is triggering? There is familial insomnia, but in a very few cases. But more of them is kind of a thing which is reactive in nature. If a person is having sleep apnea, even he will say that he hasn't slept well.
Got it.
If a person comes to us, his complaint will be very simple, that I am not sleeping well. Right? Now the importance is, when you are saying that I am not sleeping well, it can be categorized into 4 subways. Number 1 is that I do not have sleep in my eyes. That is the extreme one. One is that I am feeling sleepy, but I am not able to sleep. Third is that I take a lot of time, lot of tossing and turning in the bed. Then I get a nap, and which may be short-lived, and then again I have a problem sleeping. Fourth is that I sleep late, I get up late. These are those people who are working either in the shifts or jet lag, or for that matter, who are having a kind of a displaced clock inside your body.
Right.
Your mental sleep clock is shifted balance. Because initially, as a person who will go for night parties, who will go for any kind of work, OTTs, everything for that matter. In fact, India is a world capital of call centers. We are all working against, and especially the younger minds.
Right.
So what is happening is that we are fighting against, the time area. And sooner or later, it starts showing its effect, because we are not able to sleep thereafter.
So, sir, the four types of sleep issues that you mentioned all eventually lead to sleep deprivation.
Yeah,
they
do lead to sleep deprivation.
And what you said on sleep apnea, that 5 seconds of breaths,
stoppage of 10 seconds of breath with more than 5 events per hour
is clinically significant. then, if your partner or someone sleeping with you is noticing that you're snoring a lot,
Snoring and stopping your breath in the
yes,
middle.
so then you should see a doctor for that.
Yeah, sure.
Right? Got it. Okay. And sir, given that, we had requested our audience on what are important things they want to cover with you, one
Sure.
very common theme that came out, I think, is quite a mystery for our audience, is about dreams, right? That if they're having dreams which seem anxious, and they feel that impact sleep, or they get up suddenly in the night,
That's
is
right.
that a function of the stress they're having in the day? And are dreams to be sort of decoded in any way?
The thing is, there is no process of decoding them. It belongs to a portion of the sleep, what we call as REM sleep, rapid eye movement sleep. And this is an active sleep. Active means that you are visualizing the things, and your response of the body will be the same as if you would have seen the same thing in the daytime or wake up time. You will behave in the same manner. Like if a lion is there in front of me during sleep, I'll have the perspiration, I have my heart racing, I'll have everything the same way, minus running away.
Got it.
Because the muscle tone is totally relaxed in that period. That is a nature's way of protecting us from enacting our dreams.
Okay.
So that one, we do not harm ourselves and we do not harm somebody else during sleep. So it has it has got a percent allocation. Like if we have a sleep area, in that area we have designated, okay, the REM sleep should not be more than 15 to 20% of the total sleeping time. But in some cases, this time takes the bigger chunk. That is, goes to 30, 35, 40%. Now it has to be compensated, and it takes away the part of the deep sleep, which is your basically saving grace as far as your body is concerned, because tissue repair happens in that, growth happens in that, and your immunoglobulins for your immunity develops during this period. That is going to get hampered. So anything which is an excess is going to cause some depression in this. Like if we have a 100 rupee note, and we thought, okay, I'll spend this much money, 20 rupees for this particular thing, but I ended up buying that for 40. Now, I had only 20 rupees, 100 rupees. So I'll have to now cancel certain of the other things. So when we talk of these things, first is we should understand that it is essential, because REM sleep is also very, very essential. It is basically where our memory gets consolidated.
From short term to long term.
No, the thing is, whatever we do, the assimilation part is done during this period.
Got it.
But if it is too vivid, if it is too, and in some cases we even lose the wiring for the, are not moving gets cut down. These are the people who go for sleepwalking, sleep talking, sleep violence. They start this thing.
Okay.
Because their defective mechanism of controlling or basically reducing the tone of the body.
So, sir, the REM
It
cycle...
may not be related to exactly the thought process that is going on. It occasionally can, but not necessarily.
Got it. So, doctor, what I want you to understand is the REM cycle dissonance, what you're talking about. Does it have correlations with stress? What is the cause of it? Why do some people say that they have very anxious dreams versus others?
Actually, generally, your sleep cycles are genetically determined, more or less. In some people, it can be there more than the others. There could be missed generations. There could be people in the family who may not have it. And there are people who will have it. Of course, the thing is, human personalities, no two human personalities are alike. Some people are extremely sensitive, some are not. But this is not the major determinant for whether you are having dreams or not.
Got it. Got it. And so do you think sleep quality impacts our work productivity, our ability to perform at work?
Absolutely. Look, the thing is, when we talk of sleep, it basically sits on it is a stool which has got 3 legs. One is that the regularity, that we have to sleep and get up at the time within limited frame, of course, not pinpointingly, so that if we are regular with it, one. Second is the longevity of sleep. If we are having 6 to 8 hours, depending upon the requirement of a person, then. And finally, the sleep architecture, which I described, like if REM sleep is more and others are depleted, even though the total number of sleep hours are fine, but the sleep architecture is broken and fragmented. So as a result, if all the three things are not together in a place, then we will have sleep fragmentation as well as sleep deprivation. And this will affect our mental faculties, this will develop problems with our physical faculties. And the thing is, if we are sleep deprived, the person, around 35% of the total, say, accidents, industrial, roadside, aviation, they happen because of sleep deprivation.
Oh, wow.
Because all that you need is 10 seconds from wide awake to deep sleep. A snooze on the wheel can last for eternity.
10 seconds to
10
go
seconds from wide awake to deep sleep.
And if you're driving or you're doing something.
You do not know. You just have taken a small, say, kind of.
So people in very
snooze.
critical roles, especially, if you're flying a plane
That's
or you're operating heavy machinery or you're a
that's
doctor
right.
performing a surgery.
Well, doctor performing a surgery, generally it is basically time bound. If he is overworked, yes. But when we are talking about aviation industry, when we are talking of shipping industry, when we are talking of heavy vehicle driving, the thing is these should be first looked into, and if they are there, solved. For the simple reason, it is not only their lives at stake. It is somebody else's life also at stake.
Got it.
A huge number of people that they are carrying, even they are vulnerable to those
Right.
kind of stresses. So if that is so, treat it and then move forward from there.
So I learned a new thing today, sir. 10 seconds from wide awake to deep sleep.
Yes.
So, Dr. Manchanda, if we had to talk about the regular corporate work life where, people are operating in a workspace on a laptop most of the times, what can an organization do for its people? Because there will be certain sleep deprivation in certain people. In a 9-hour work day, can the organization do something or the individual do something at work to ensure that, they are able to manage their mental health better?
Actually, there have been, when I've taken lectures for certain corporates, we must appreciate one thing, that there are natural larks and there are natural owls. People who perform better during the day and people who perform better during the night.
Okay.
If we can segregate this group by analyzing, okay, he was good in the when he's put into the night posting, we can make a pool of these people rather than shifting everybody from every place. Because a person who doesn't gel with the night work and he's been asked to do it,
Got it.
he will not be able to perform to his potential. One, the results suffer. Second, mistakes would be more. Accidents could be more. And,
Performance will
performance is bad, so, you are not in the good books of the management, feeling that he is not good enough. But actually, he is a person who is not a night person.
So personalizing basis the personality.
That ideally should be done. So that you have a pool of people who can be rotated in the area.
Got it.
There are a pool of people who can, and instead of, say, a 9 hours shift, you can reduce it into 3 different portions where you can assign them according. The people who are neither very sharp in the day or very sharp in the night, they can be given the middle slot.
Got it.
So your productivity improves, your work performance improves, and everything is in a better shape, and the person whom you have hired, he is able to do it better.
Got it. So, Dr. Manchanda, since time and ages, we have also learned that, a small day nap helps keep your heart healthy and helps you perform better. That's not a possibility today in a work life. But what is the mystery around day naps, and is it really good for the heart, good for health?
The thing is, it is good for, the thing is, there are people who require it. One is who have cultivated the habit that after a lunch, they would like to go for a 20-minute shot. But we also call it as a power nap. It's fine. But once it is required more than that, then we should look at the underneath. There's a condition called narcolepsy. It's a neurological sleep disorder and generally inherited. Now, what happens to these people is that they have excessive amount of REM sleep, that is the dreamy sleep, they are sleepy throughout the day. They have sleep attacks rather. Attacks means there's 20 minutes, 25 minutes, and then they are up and above. Then if these are the patients are having an underlying disease of this category, then naps should be programmed. Apart from the medication which will give them the benefit, but the naps should be programmed. Like you should know that what are your lean periods of work.
Got it.
Okay, if you are between 12 and 2 or 12 and 1, you are having this. So they should, if in any corporate setup or in any setup for that matter, you should be given a space to take and relax somewhere. And if there
Okay.
are 2 or 3, say, naps required, then you must know, okay, this is the period when I don't work much. This is the period where we can change it. So then, put it, and with the medication, if you're improving, then you can reduce the number of the naps
Got it.
and you can work it out better.
So Dr. Manchanda says that for an organization to be truly inclusive, there should be power nap pods or rooms for people
No
who
harm.
need it, because some people may need it and may improve their performance and their mental health. Thank you so
Yes.
much for that. So doctor, we are now segmenting into a very important piece of discussion, which is factors impacting sleep, right? And eventually leading to stress, impacting performance. So we'll cover a few things. The first one, which is a big sort of an evil in the country and the world today, is digital devices and
Yes.
digital content,
Yes.
which we get hooked to before sleep. And just before sleep, we switch off our phone or TV. Do you think that has an impact on sleep?
A huge amount. Especially, look, when we talk of this, the perspective is the patient is already not sleeping very well. Because those who are doing it well, they would not even turn to the doctor.
Right.
The person who will come, who started getting the problems. Now, the thing is that these devices, they emit light, which we call as a blue light. And it has almost the same frequency as that of a sunlight. So mentally, your retina and your brain perceives it as a day.
Okay.
And the importance, I'll lay in this importance also during when we'll talk about sleep hygiene, if we will.
Yes, we will.
So the thing is that phones, unless you are a person who is dealing into emergencies, like a doctor cannot switch off. He has operated a case, the
Right.
problem is occurring, he has to respond. Like police, they have to be there when it is needed. But by and large, most of the people can just get up in the morning and have a look at what came in the night.
Right.
That is something. And in any which way, if your vulnerabilities are there, then you have to exercise them with a stronger kind of a thing. So one thing is that, okay, these devices have a problem, you should not carry them in the bed.
Okay.
Like, people sleep with their laptops, they sleep there with their phones on their sides,
Under their pillow.
pillow or anywhere for that matter. Look, anything, even a single tinkle is a sleep breaker.
Okay.
And for the people who are sensitive, it is worse. So immediately your first response is, what is the message?
Right. So
Now-
what you're saying is, we should stay away from the blue light before sleeping, and
We should be away from these devices once we have decided to go to sleep.
okay.
Essentially, if it is required, the better thing is it should be not silenced. It should not be on a silence mode. It should be shut down. And it should be charged in a separate room.
Okay.
Unless and until, again, if you have a problem, and if you require at that time, fine enough. But by and large, should avoid, like watching television. Now, what happens is that, we are trying to sleep. And, you also have started getting the feeling that you are sleepy. But you are watching a kind of a program which is very interesting. You would say, okay, another 10 minutes and I'll go off to sleep. By the time you get up from that, your sleep cycle has gone. And now that will come after 1.5 hours. And again you are petrified, again you are having anxiety, again you want to look into something different.
Got it. So it's a never ending.
It's an ongoing process. So these devices are important, but again they should be worked when they are needed to be worked with. It should not be always with you.
Got it. And we'll cover about, the timing in the sleep hygiene piece. Thank you so much, Dr. Manchanda. And also wanted to cover, Dr. Manchanda, you said that, in today's city life, people go out, they, of course, party, meet their friends, all fine. But there's also a problem of excessive alcohol intake, right? Do you think alcohol intake has something to do with
Very,
sleep?
very bad effect. Actually, it is again a thing where somebody asked a doctor, who is an alcoholic? The one who drinks more than his doctor drinks. So, what is important is that alcohol has got a derogatory effect on sleep per se. It may help you go into sleep, but as far as the maintenance is concerned, because it can increase your nightmares, it can increase your REM sleep rebounds. As a result, you are not at all fresh after taking it. It's not just the quantity, it is just the alcohol per se, like medicines. They do relax your musculature, but they also shut down your brain, which is your wake up organ or which is your saving grace. That is also lying, silent. So it takes brain to understand after a longer period that there is a problem which is occurring and I should get up.
Got it.
So the thing is, it cannot be taken as a sleeping pill. It cannot be taken as a sleeping agent.
Or a relaxing agent.
Or the thing is, fine enough. And if you have to take it at all, it should be at least 3 to 4 hours before this. A drink, say around 7 o'clock and sleeping around 11 is okay.
It's fine.
But not over drinking. Ideally, if you have a tendency, you should not take it.
Got
If
it.
you don't have any problems, okay. But still, that distance needs to be maintained.
Very fair. Makes sense, doctor. And good that you're being so practical that people won't stop doing it today, but at least they can maintain their hygiene.
They have to understand that.
Yes, better sleep. Great. Thank you so much. And what about coffee, tea, caffeine?
It's the same thing. Actually, smoking, coffee, cigarette, they're all stimulants. So if you are vulnerable to poor quality of sleep, if you are vulnerable for being able to sleep, then in those particular cases, it is extremely important for us that we pick up and choose the right kind of a person for everything. So it is important that we must know what we are suffering with. Only then it is worthwhile.
And even if we don't have a sleep problem, it's good hygiene to have a 3-4 hour distance from sleep is what
the thing is, you as a kind of a, say, sleep hygiene point, there are multiple, but which are easily implementable. Which is something which is totally implementable. But and these are again things for people like, now you ask for tea or coffee. The thing is, since they are stimulants, if you take it, it will make difficulty for you to go. So if you are you want to sleep around 10:30 or 11, the last cup you should have it at 6.
Okay. Very, very valid point. So Dr. Manchanda is saying that if you are sleeping at 11, the last cup of tea or coffee you should have is around 6 o'clock or, around that and not later than that.
Yeah.
Great. And doctor, talking about some positive factors now, do you think good diet and active physical exercise helps us sleep better? Does it have a connection or no?
Look, exercise is always good. Good diet is always good. But having said that, the thing is, you should have a breakfast like a king, and your lunch like a common man, and your dinner as a pauper.
Yes.
Because the lesser you are having food inside, the easier you sleep. The regurgitation is not there, reflux is not there, acidity reduces, you feel better. Because if you take food and sleep immediately, a lot of food will go up. There will be a digestive problem. There will be other problems as well. So one is, yes, food is important. There is no. But having said that, what was the first?
The exercise, physical exercise.
No, the exercise part of it. Ideally, it should be done in the daytime and not in the night, as the youngsters hit their gyms in the evening.
Okay.
Because to sleep, you require a relaxed body, not a tired body.
Okay.
A lot of people feel that if we are too tired, we will be able to sleep. No. The day you are too tired, you put your pillows under your knees and try to sleep and not able to sleep. So it is important that exercise should exclusively be done in the day, not in the night.
Or early morning.
Early morning, well, the thing is that depends upon you. You can even start at say 7:30 also, but one, it has to be almost regular. Second is that after 6 p.m. to 7 p.m. You should not do it.
Right. So I think 6 to 7 p.m. is a golden time.
Is a time where if you are a sleeper who wants to sleep by 11.
Yes. So, no heavy meals, avoid alcohol, smoking, all of these things.
Unfortunately,
and
we
exercise.
take the highest meal in the night only.
Yes, because it becomes a family time and
Family time and, day you might compromise a lot because of your work schedules. And
Right.
But when you come in the night at home, then you take anything which comes your way.
What I've learned, Dr. Manchanda, is that, if you pre-plan your meals of the day very well and have your dabbas with you in office, then, you don't mess up on your eating schedule. Otherwise, what happens is you are always hungry, and in the end, you're hungry at night.
Yeah,
and
the thing is that the way we eat food is also extremely important. If we have 32 teeth, every morsel that goes in should be chewed at least 25 times. So that it should be semi-solid when it goes in. Similarly, water should not be taken like a single shot. It should be sipped. Because if you take water suddenly, it will push the food down and will create further hunger.
Okay.
So it should be taken sipped slowly. So as actually in Hindi, they used to say, the buzurg and the elderly people, कि खाने को पीना चाहिए और पीने को खाना चाहिए.
Okay. So chew it so many times and
Then it becomes a liquid.
Okay.
And the liquid should be taken as if you are sipping.
As if you're eating. Almost.
Yeah.
Wow.
Slow, very slow.
That's a nice thing. Thank you, doctor. Great. I think that helps us understand, factors that are impacting sleep. So we know the root causes and not just work on the symptomatic treatment. Now, coming to a very important segment, Dr. Manchanda, which is on how do I sleep better, right? So not many people will be diagnosed with sleep disorders. Not many of them even show up to the doctor. But a lot of times, friends and colleagues would say, didn't sleep well last night, right? So are there tricks and tips to fall asleep faster, or what we call sleep hygiene?
Well, faster or not is something which is individualistic. But there are points of sleep hygiene which will make you sleep effectively. And we have though covered it, but now I will put it into a nutshell of
Yes.
it. Number one is, go to bed only when you are feeling sleepy.
Okay.
Don't go to the bed for sleeping, because bed is not a sleeping pill. And if you are lying on the bed and not sleeping, it gives you slowly you become anxious. So you start believing that I would not sleep. Sleep to aayegi nahi, it will not come. So as a result, what happens is that it comes onto your head in a very wrong way. Second is, no matter what time you sleep, your get-up time should be common.
Okay.
For the simple reason, if you try to compensate in the day, again the next night you will sleep further away. So your body internal clock is going further ahead. Now you would be sleeping later than you were sleeping earlier. So slowly, chronotherapy is the time therapy.
Right.
So once we are there, at that time we should try and level this thing correctly, so that it doesn't exceed the areas again and again. And that is what happens to the night parties also. That sometimes you want to sleep at 11, sometimes you want to sleep at 2. So what happens is the clock is totally in kind of a confusion as to what is your actual time of sleep.
Correct. So to respect the body clock, because
Actually, there was a beautiful quote in that. You can fight and win many battles, but if you fight your biology, you're likely to lose.
Okay.
And we are fighting a losing battle.
Right.
That is the problem. Now, the third thing is that if you are trying to Another important issue is remove, if you are a person who is sleeping poorly or not able to sleep, remove the clock from your room. Any kind of clock.
Okay.
Reason being, when you are on bed and everybody else is sleeping, every 3 or 4 minutes you are going to look at the clock.
Okay.
It's normal reflex. It hasn't come yet. It hasn't come as yet. Now, as a result, what is happening, it is causing a lot of anxiety into your mind. And that is where you start, even for that matter, the blood pressures might shift and acidity would increase and you are not feeling good about it.
Got it.
Then the fourth point would be that, again, which we emphasized earlier, that when you are onto the bed, your purpose is now sleeping. Remove your all devices from your sight.
Got it.
It shouldn't be there. The television should stop at least 45 minutes before your stipulated time of sleep, no matter what is coming. Because if you don't do that, you will succumb to the pressure of seeing some more and then again not being able to sleep. And another important issue would be, do not take any tea or coffee after 6 p.m., 6:30 p.m. That is, if your normal timing is around 10:30, 11:15, 11:30, it's okay. But do not take it. They are stimulants and they will cause wakefulness. Smoking is again a stimulant. It will again cause wakefulness. Now, alcohol, we have already discussed that it may start the sleep early, but it is a poor maintainer of sleep.
Got it.
Now, and exercises we have discussed vigorous exercises should be done only in the morning if they have to be. Whether it is brisk walking, running, whatever you want to do, it's fine. Weights or whatever.
Right. And Dr. Manchanda, is there an ideal number of hours of sleep, ideal waking time for a person?
No, it is individualistic. It is work-oriented and individualistic. But till the time is a child, he is working according to the clock, more or less. And since these children today are, even 4 years child know how to open up the site where he would see his cartoons.
Right.
He or she would see their cartoons.
Correct.
Now the problem is people feel that it's a good riddance, at least they are busy in themselves, which is wrong. You have to devote time to your children because interaction is the best thing. Otherwise, they will be learning something which is not correctly interactive. And that in a long run is not a very good idea. That is, I'm talking as a psychological thinking process. But otherwise, one should not, give too very frequently these devices to the children.
And it impacts their sleep as well.
Of course it does. The thing is, you see the children, if they are in a separate room, you never know. They are watching their things even in the night. They are communicating with their peers in the night. And they get up in the morning, they are tired, they are exhausted, they are not as fresh because in adolescence you need slightly more sleep than you needed at, say, slightly earlier or later. At that time you need nearly 9 hours of sleep.
And as an adult, like for a 30, 40-year-old?
4 to 6 hours is fine. 6 to 8 hours is fine.
6 to 8 hours.
But yeah, the people who do meditation together regularly, for these people, 4 hours is enough. That is, their requirement reduces by 2 hours.
Yes, we've read that about our Prime Minister.
Yeah. Not only that, he is their example. There are other people who are example. The thing is, if you are doing these activities, they are very powerful kind of workouts. Though they look very innocuous, but they are very powerful. And they arrange you for, and your mental health is much better with that.
So you're saying if you're meditating regularly, then you can cut down on your sleep hours by 2 hours almost.
The thing is, that comes automatically. You will be fresh after 4 hours. Now, it is for you to decide the day, how do you progress your days. As if somebody asks me a question, that what is the criteria of a good sleep? The very simple answer is, if your day is good, your night was good.
That's well said. And doctor, when you say meditation, just I'm going to a tangent here. But do you think people who meditate just before sleep do better or in the morning?
There are generally 2 times it should be done empty stomach.
Okay.
Because a filled stomach will not allow many of the things. And meditation doesn't need to be for too long. 15 to 20 to 25 minutes is more than enough. And the thing is, it will not come to you in a single day. It happens to you over a period of time.
Got it. But it's a practice which
It's a
can really
practice
help
which
people.
slowly gets into you.
Very, very well said. Thank you so much, doctor. And you spoke about bed is not your sleeping pill earlier,
that's
and you know
right.
it creates anxiety. So talking about sleeping pills, because it also menace for some part of the society where people may have taken some anxiety pill sometime and then they resort to it if they think they're not getting sleep. So what's your take on that?
Yeah, the thing is, it's a very, very touchy question for me. Reason being, the patients would say the same thing to most of the doctors. And that is that we don't sleep well. The simplest answer is, okay, take an Alprax or take this tablet. Now, what happens is that, unless and until you understand why the sleep is not coming correct, because, there are times when they are being prescribed 3, 4, 5 drugs, which they never needed. And all that they do is that whether the sleep became good or not, but their day has become worse.
Right, that's true.
They are tired, exhausted all the day because the after effects are coming. So first thing is to realize that what are you suffering with. So the difference is the same. That is between the cluster bombing and a laser guided bombing. In cluster bombing, you kill anything and everything that comes your way. But when you're talking about laser bombing, this is my target. And that can only come when you're doing the right kind of a sleep study, for knowing what you are suffering with, and then treating it. And you can treat it with a much more lesser dose than otherwise you are taking. So the side effects, they reduce. The daytime sleepiness, it reduces. The quality of sleep improves.
That's a great point, sir. And just, going further on your point of sleep study. So who do you think needs a sleep study? Can we define a persona for our audience here?
Look, the thing is, if a person is having a sleep problem, which occurs to you, which has occurred to you maybe around, say, in last 2 weeks, 3 weeks, maybe some because of bereavement or some kind of a problem which has occurred in the office or the working area, or your boss has not been very good to you, those are minor things. In this, a simple tranquilizer should start affecting or helping the person.
Right.
But having said that, if it is lasted for, say, around 3 months, then it has become a chronic kind of a sleep disorder now. Now you need to understand what is the actual disorder. Well, it could be anything and it could come at any age. Now there is one condition what we call as restless leg syndrome.
Okay.
This is a condition where the nerves of the legs, they keep on twitching. And they twitch hundreds of times in a single night. They are at mental level, they are all breakers of sleep. So what happens is that at the superficial level we are sleeping. But when it comes to the internal thing, it's a broken and fragmented sleep at brain level. So as a result, when you get up in the day, you are not at all fresh and you start having sleepiness during the day. So first thing is, okay, we should know, at least we should anticipate what all is there. And since in a sleep study, specifically if we are talking of polysomnography or a thing which we do in the laboratories generally, where we study your brain activity, your eyes activities, your muscles, your heart, your breathing, your body position, your leg movements, everything is being recorded live. So we know these things are affecting and they are causing micro arousals, and the patient is, having a broken and a fragmented kind of sleep.
So you're able to discuss all this data with the patient as well?
Yeah, sure.
And there are many places in the country today where this can be done?
Yeah, but reading is an important thing. Relying on machine to answer the questions is something dangerous.
Okay.
Because it will miss a lot of things. And if you're basing on those, then you may not be, person might feel slightly better. But having been and getting fully treated, they are two different things altogether.
Got it. So, sir, while you covered a lot of things around, what means sleep is not of optimal quality, but to summarize, what are some of the warning signs that people should look out for to know that this may be leading to a sleep disorder and I should see a doctor?
The patients are the best judges. The thing is, look, and it is in, say, comparison to what was happening in the past. Now, if you're feeling that, okay, I'm not able to sleep as swiftly, I'm taking much longer time to sleep. I am having, started having snoring. And I'm feeling I have to get up for urination in the night. I have more of acidity. I get up in the morning non-refreshed. And the thing is, I feel sleepy during the daytime at the work time. And people feel that I'm not interested in work.
Okay.
Now, these are the areas. In children, it is slightly different. That is, the things are more or less the same. But in children, the bedwetting increases or has been there for a longer period than normally should be. In adults, it is nocturia, that you have to get up for urination again and again. In children, it is bedwetting.
Okay, so what you're saying is if people get up during the night to,
If they're getting up 2 or 3 times, that basically is telling that
you may think you're getting up to urinate, but it means there is a broken pattern.
no, the thing is, what happens is that during sleep apnea, what is happening is there is a chemical which is being released. And in the medical lingo, we call it as atrial natriuretic peptide. It
Okay.
increases the production of urine. So, person might have to get up for urination in the night.
Okay.
There are a lot of patients, where the cross wires go in, and they are being, asked, okay, you might be having an increased size of prostate. But we have treated the cases that after the treatment of sleep apnea, they never had the problem.
Oh, wow. So they thought it was prostate related.
Similarly, I ask my colleagues in cardiology to see that, okay, if there is a cardiac rhythm problem, the answer is cardiac pacemaker, if it is that. But if when we do the kind of the 24 hours monitoring for the ECG, and we write out the time, that at this time I use the staircase, this time. So to know that, okay, these are the times when he was doing a strenuous activity. If we broadly classify that into sleep and non-sleep phase, if the arrhythmias are occurring predominantly in sleep, then the trigger is in sleep.
So what you're saying is a lot of these disorders like frequent urination or even cardiac issues, we attribute to other things maybe related to sleep apnea.
Yeah.
So diagnosis is very important. Great. Thank you so much, doctor, for your amazing insights. We have a lovely audience here who has posted certain queries on the webinar portal. So I will be covering those, sir, one by one, and will really help our audience. So the first one is, what are the causes of snoring disorders?
Snoring, as I told in the beginning, if you have seen the program right through, it is essentially the narrowing the airways, and when the air moves through a narrowed opening, the surrounding structures, they start vibrating. This vibratory sound is snoring, and in people who snore, it is the muscles of the tongue and the palate, they start vibrating because they are free. And if there is a lesser space and the air goes through that area, it will cause vibration, and this is called snoring. And essentially, it is related to the neck structure of the person, or a lower jaw more precisely. If they have a smaller lower jaw, if they have a receding chin, then these people are likely to have snoring. Even for that matter, elongated faces. Anything which contributes to narrowing of this area, that basically leads to snoring.
And sir, weight or any other health issues which cause
Weight
this?
is an add-on factor, a big add-on factor. But it is rarely a pure cause of sleep apnea, because if that was the reason, then underweight people would not have sleep apnea.
Or snoring.
Yeah.
Got it. Great. Makes sense. Sir, there's another follow-up question on snoring, which is that if people are snoring a lot, does it mean that subconsciously they have poor sleep?
Of course, they are having a poor sleep. The thing is, because when you are getting choked, your sleep is broken periodically, hundreds of times in a night. Because every time you are being choked, when the release occurs, like there is a break in sleep. So the muscles, they go for some time into the control, then again goes into the silence.
So a sleep study or see a doctor would help
us.
here.
That will tell us beyond any kind of a,
Makes sense.
imagination.
So another question is on sleep paralysis, that what is sleep paralysis and is it harmful? Do I need to see a doctor?
Yeah. It is one of the most important, features of the condition called narcolepsy. Sleep paralysis essentially means that a person has few seconds of sudden loss of, say, a kind of the control over the muscles. there's a tendency to fall and then get okay thereafter. So these can occur anytime, working time, driving time, anywhere.
So when you feel like you're about to fall and you get back.
That is called, actually the sign is called cataplexy, which is the most important signal of narcolepsy. But sleep paralysis, generally we say like drifting into the sleep and coming out of sleep. For few seconds you are not able to use your muscles, you are able to listen to everything but not respond.
Got it.
And it is a problem. And you have to look underneath because it has got a longer kind of a treatment. The medicines have to be given for a longish period.
So what frequency, like how often have I had it for me to go to a doctor?
No, the thing is, if the history is there, we need to evaluate.
Okay, got it. So yes, it is important and people must take it seriously. So another question we have from our audience is, what are some relaxation techniques to calm the mind at night? Because after a day of work and stressful work, all you're thinking while you're trying to plan your sleep is what happened during the day. And, you know, a lot of people have a lot of work stress.
Look, everybody has got their own stress busters. Some people using music as their tool. Some people use it, the pictures as their tool. There's some people, draw the pictures. So that is a different kind of a zone, but that is a stress buster in themselves. But having said that, the problem, if it is exaggerated, you must get yourself analyzed.
Okay. And you're saying otherwise practice some things like music, art, or whatever,
your
reading.
Pranayam, your meditation, they are always good.
Yeah.
Even exercise is always good. Losing weight is good. But they may or may not be therapeutic for that kind of a thing.
So telling a story to your child, right? I found that to be very therapeutic before sleep.
But yes, I agree for the children, because that interaction gives them a kind of a tool. It's not just the story which is helping. It is the mother telling the story. That is the difference.
Right. I truly agree, sir. Makes sense. So there are some folks who may work in night shift, right? Or there are people who travel a lot and they come back home around 12 a.m., 1 a.m. because there's a flight, it gets delayed and they, come back home. So for such folks, either night shift or traveling often, how do they manage their sleep?
Look, the thing is basically, as far as time zones are concerned, like, coming back from America to India, there is a huge time lapse. Now what happens is we are 10 hours earlier than them. So we are following the time at the double area.
Right.
Now what is happening is that you are mentally tuned over there and it is still running ahead of you. So then there are smaller medications which are nowadays on OTC kind of a preparation, like that is called melatonin. So melatonin is actually a kind of a
sleep hormone.
It's a sleep hormone, but is a medicine which is given to enhance that kind of a sleep earlier.
Okay.
So that the patient doesn't go into that ring for too long.
Okay.
It is not that it will evaporate, but it will reduce in its intensity.
Okay.
But should not be taken as a sleeping pill. Only a sleep modifying drug once you are a big traveler.
But if someone is in a night shift, then can they take it for a few days to change their...
They can change it. They can take it. But having said that, the thing is, obviously the night shift and the day shift, as I told you, if we can identify our pools, we'll do much better.
Makes sense, sir. Sir, then there are questions again on, dreams, that if someone notices that they're having too many dreams and remembering those dreams the next day, is it considered to be some sign or bad?
No, the dreams in excess are themselves bad. It is important, though the dreamy sleep is important. The REM sleep is important for memory consolidation. But having said that, if there are too much of it, if the percentage is high, then it is a very draining kind of a sleep. And once we know that, okay, this is happening to the person, there are medication which will cut down the REM sleep and increase the deep sleep.
And are these short-term medicines or to be taken long-term?
That depends upon person to person.
Okay. So it's better to discuss it with the doctor once if you notice this.
Yeah.
Makes sense. And if, there's another question from our audience that if I wake up tired, what should I do? Is it related to my sleep? Should I do something about it?
If you're getting up tired, then there are a whole lot of sleep disorders that I have told you. The thing is, it could be the tiring could be because of sleep apnea. The tiring could be because of insomnias or dysomnias. The tiring could be because of restless leg syndrome. The tiring could be because of narcolepsy. The tiring could be because of any number of sleep disorders. So if you know what disorder you are suffering with, and for that you need to get, say, investigated, and then treat that particular point.
Makes sense. Great, sir. I think we are at the hour. I truly, from on behalf of everyone at Zyla Health, thank you for encapsulating your 30 years of rich experience into this amazing dialogue we had with our audience today.
Thank you.
On behalf of Zyla Health, I thank our amazing audience that has been so patiently listening and following Dr. Manchanda's advice. We hope that you make the most of it, and we hope that you sleep well tonight. Bye bye. Take care.